Hello, everyone. I'm John Lynn, the founder and chief editor at Healthcare IT Today. And today's topic is one that's close to my heart. It's talking about patient experience. It's talking about engaging patients. And I have two special guests with me today. First, we have Lisa Brown. She's VP of Strategy and Growth at Stride Community Health Center, and Jennifer Trainer, Director of Patient Experience at Stride Community Health Center. Welcome, Jennifer. Welcome, Lisa.
Hi.
Yeah, so I'm excited to have this discussion. And as full disclosure, I'm also VP of Marketing at or CMO at Carecognitics. So I have a relationship with the company we're going to be talking about, and have done a lot of work with them. But before we dive into your experience with Carecognitics, how about you tell us a little bit about yourself and Stride? Lisa, maybe you want to start?
Yeah, I'd be happy to. Stride Community Health Center is based in Denver, Colorado. We serve the whole metro area as a federally qualified community health center, which means we provide physical, behavioral health, and oral health services to patients regardless of ability to pay. I have been with Stride for about 3 years now and have had about a decade of experience in FQHCs, which is the federally qualified health center world.
Yeah, so I think the FQHCs are so fascinating, but maybe, for those that aren't familiar with them, Jennifer, maybe could you help us understand how is it working at a FQHC different from how other healthcare organizations, especially when it comes to engaging patients?
Sure. Federally qualified health centers, we serve the underserved. Our populations are some of the most vulnerable populations. When it comes to the differences in serving them, a lot of times we talk about being the provider of choice rather than the provider of last resort. And so that is something that's important to us because it really guides the way that we want to communicate to our patients and let them know about their choices. And a big part of what we get to do is think about empowering patients and raising the level of just health literacy. With the communities that we serve, oftentimes you have patients who are utilizing the emergency department rather than getting primary care or establishing with a primary care provider. And that is not just about a behavior, but also about just an opportunity to empower and bring them into what we can do for them and really understanding what their needs are and helping them navigate such an incredibly huge system that is healthcare.
Yeah, the complexities of healthcare. I actually like to talk about the FQHCs as kind of the gem of healthcare. We need more efforts like this. So it's great the work that you're all doing. We're obviously during COVID, you've been leveraging the Carecognitics platform in a lot of different ways. And, you were working with them before COVID and, leverage them in a bunch of different ways. Lisa, could you share kind of what interested you about the Carecognitics platform that made it a good fit for your organization, and how has it helped you and your patients?
Yeah, so we first met Carecognitics through the Prime Health Challenge in Colorado, probably late 2019. And we're just starting to put together, we're learning about the two different companies. What really intrigued us was using the sort of the gaming learning that Carecognitics has in how we can better engage with our patients. And part of our makeup is we work with the Medicaid agency in Colorado that helps they have members attributed to us, and about half the members who are attributed to us are geographically attributed. So we've never actually seen them, but they logically we would be a logical primary care provider for them. So what we really initially started talking about, spent a long time doing some discovery, is how we could use the platform to engage with those members who are not yet our patients. And then it was literally in March of 2020 that we were getting ready to start launching. And then as all of us experienced the pandemic and COVID, Carecognitics really started pivoting, and we knew enough about the platform and how the technology could be used and leveraged, and Carecognitics right away was starting to evolve their product to be of use, and we very quickly started using it with our own employees to help ensure being able to keep people safe and identify symptoms and have quarantine sooner than later. And it's very much from our partnership with Carecognitics that we were able to stay open, serving sick and well care, and retaining all of our staff throughout the entirety of the onset and duration of the pandemic. So that was just like the very start of it in March of April last year.
So tell us a little bit more about the employee experience. You'd send them a daily survey to understand their needs, and what were you asking them, and what was your experience like?
So we were asking, and we were one of the first to really set up some of that screening that we experience all of the time now, because we never closed, we consolidated. And so it really was, have you had an exposure? And back then it was like, have you traveled in the past 14 days? So really the basic screening. And then another layer that we added onto it, because we were in such a chaotic environment, was just assessing how people were doing, saying, how are you, on a scale of 1 to 5, how is your emotional health today? On a scale of 1 to 5, how is your physical health today? And then we also asked, do you know what you're supposed to be doing today? Because we literally went from dentistry was logically and legally closed in Colorado during this time. So we had dental hygienists who were helping with COVID testing. And so like, where am I supposed to be on Thursday? So their responses then go into the analytics platform, and then that helped our HR and operational leaders be able to check in on almost more of a population health level, but with our own employees of how they're doing. So that was the methodology, and we really only started to transition away from that as we're moving into a high percentage of our employees having been vaccinated now.
That makes sense. Jennifer, what else have you used the Carecognizance platform to deal with during COVID? And it's interesting you started with employees. How about testing and vaccination? Can you tell us a little bit about that?
Yeah, the Carecognitics platform has been incredibly helpful from that perspective. We have been able to use it to reach out to people and offer vaccination. So what happens, and I personally have done this for every individual in my family and in-laws who has been eligible for the vaccine. So I've got everybody, I think I've gone through it like 15 times. It allows them to indicate that they're interested in the vaccine. It walks them through some of the compliance pieces that we need, like the notice of privacy practices and what to expect. And then indicating what part of the target population that they fall in. And then it's really slick. It lets them know they are on a wait list. The incredible piece of it is that we didn't have the ability to set up online scheduling for vaccination, which as you can imagine, we're doing drive-through vaccination. And so flow is so important. And the ability to schedule people for a certain window of time was critical. And Carecognitics really made that happen for us. And so it was this incredibly easy user interface where you can select which window of time you're interested in getting your vaccine and just submit. And then they get an email back that they're ready to go. And our employees have been at the drive-through site. They are working off of tablets, and they use the Carecognitics platform to really quickly identify who is in line. And it's a nice visual representation for them to see, do I have all the information that is needed for this particular patient? That's really making our flow go well, which is critical in these drive-through vaccine clinics. I mean, it's winter. A lot of our vaccine clinics are happening in parking lots or in parking garages. And because people are scheduling a window of time, they certainly don't want to be taking 5 hours to get through a parking lot or a parking garage in the winter. And so the Carecognitics platform has been incredibly helpful to making this go smooth, both for the patient and for our employees.
Interesting. So what would you have done without it? I guess you would have just been searching for a solution, or I mean, I think that's one of the challenges I hear when I talk to a lot of FQHCs is, that you don't have a lot of funding, right? I think that's always a challenge for many of the FQHCs, and so it's challenging to find a solution that really impacts it. Any thoughts on how you would have approached it otherwise?
I do, and Lisa might as well, but I'll kind of start. It would be incredibly resource intensive at a time that resources are already incredibly overused and even sparse. We would also, so one of the beautiful things about the Carecognitics platform has been the personal attention and the customization that has been offered to us. We, in the middle of COVID, changed to a new EHR, which did come with a patient portal. The ability to get all the functionality in that patient portal live and implemented during this time was a little bit lagging what we were able to launch quicker with Carecognitics. And I don't know, Lisa, if you wanted to add on to that one.
Yeah, I will share that it would have been, our whole effort, I believe, would have been markedly smaller and slower without the partnership that we had with Carecognitics. And it's one thing that we've been able to do is be able to have this mutual relationship where we bring the best of sort of like sharing what's going on in our world, and Carecognitics is really good at listening to that and then offering suggestions, and then they bring an idea forward, and then our nurses and COVID lead team will be like, oh no, this is what we need to do. And it's like having that partnership has been remarkable in helping us to be able to scale and go much faster than we would have been able to otherwise.
Yeah. I think that's what's interesting about health IT is having a good partnership. How was it with vaccinations? Was the demand just overwhelming, or did you have to drive demand? Because I think the FQHC population is a little different than some of the populations out there.
We're in a little bit of two places. I had an interesting experience with this from a friend of mine who gave me feedback on one of her neighbors posting about getting her vaccination at Stride. And then and this all happened over the weekend, and then on Monday, I come in because I'm not on the front line of the vaccine, and I hear what Carecognitics did that I saw reflected just through my own social network. So we're in a place where we have our FQHC patients and we're a community partner. So we're both helping to vaccinate our patients and helping to vaccinate the Metro Denver area. And we had a partnership with a school district specifically for their teachers to come in, and for all the reasons that we're encountering, maybe they are already getting it through their healthcare provider. They were on multiple lists, which a lot of the more resourced people we're seeing in communities can get on multiple lists. So we found that we had one Saturday that we had a lot of vacancy we were set up, I'll just sort of extrapolate these, we were set up for 600 people, and going in about 36 hours before, we only had maybe 200 available. So Carecognitics was able to turn around and push out to the wait list, where then we really expanded the eligibility. So our prioritized target market wasn't available that Saturday, and they helped us be able to use all those vaccines and continue serving the community of Colorado.
That's awesome. Nobody wants to see a vaccine go to waste.
So it's helping the whole system be more efficient.
Yeah, that's awesome. So I think it's interesting, the workforce stuff, did the COVID testing, the COVID vaccination, but Jennifer, you guys are working on a value-based pilot as well. What are you working on there, and what's going into that project?
We are, as Lisa mentioned earlier, we are trying to reach we call them our attributed patients. So individuals who through Colorado's Medicare program are attributed to Stride. We have about 25,000 patients who are considered Stride patients through the Medicaid provider, but they have never been to Stride. They are seeking care elsewhere. Often they're seeking care in the emergency department. And so a lot of times these are patients who have complex care needs. And so this partnership with Carecognitics has been, how can we rapidly, easily reach out to that large of a group of people, 25,000, and let them know we're Stride, we're here, and you're one of our members. We're here to help you. And so we have been creating this pilot. One of the things that's been so helpful with Carecognitics on this partnership has been their support and perspective, like the learning perspective. They've really approached this with that experimental mindset, like let's try this and then let's pivot. If that works, cool, let's expand it. If it doesn't, let's pivot and find another way forward. That has been incredibly helpful at any time, but especially in the current pandemic world, to have a partner in pivoting, right? To have a partner who's like, that didn't work, it's okay, we know the way, here's 3 more ideas that might work. They've had that creativity and just that experience where, maybe we didn't know the way forward.
So I think that's really amazing. It sounds like it's a big marketing effort to try to find, I've heard some people call them the invisibles, the ones you're responsible for, but you haven't ever seen in your clinics yet. Is that what it is? It's really about informing them about Stride and as a marketing effort, or how would you describe the project?
Yeah, I think it is a little bit of marketing effort. It's a hard line to walk because it's also not something that we're really selling or trying to get them to do anything extra or give anything extra. And so a lot of our messaging is really like, these are benefits that are already available to you. And so we do have contact information for these patients. We have their phone numbers. For some of them, we have email addresses. And that was one of the pivots that Carecognitics really helped us with. So what our project looks like right now is it is a text campaign. And so we've started really small and we're taking these small batches. We started with 50 patients' phone numbers and we sent out a nice little text. Hey, we're Stride. This is a benefit that's already available to you, and contact us if you would like some more information. So we've developed an entire workflow. I think we reach out to these individuals 3 times, and each communication is a little bit escalated and gets a little bit more personal. I think towards the last one, it's Brenda, who is true, there is a real Brenda. Brenda's one of our care coordinators or care managers. And she's saying, hey, I'm Brenda and I'm here to help you. Click this link and I can contact you. That's the other part of this pilot is we're giving them a little information and then a link for them to click. When they go into that link, that's them saying, I'm interested in hearing more. It then goes into a workflow for our care management team to reach out and make that connection with the person. This was important to us because we didn't want to just direct people to a call center. Yeah. We didn't want to do that to them, and we didn't want to do that to our call center. And so this is a much more personalized, individual connection with these people.
So what's the value to Stride of, really engaging those people? What's the value you receive? And also, what's the risk model you're using with Carecognitics?
I'm happy to talk to that a little bit. The value is that we are contracted with our Medicaid agency. We receive, we have 2 varieties of it. One is a per member per month, and depending, there are some third-party administrators, so we work with 2 separate ones. One of them, the per member per month, increases when we have engagement directly with our clinic. So folks are coming in. So there's one part of that. We also have an incentive pool that we are involved in across our whole region. So we help contribute to that. So, and right now, a lot of it is, some of it's on outcomes, a lot more of it is on have people had a dental visit? It's really helping. The goal of Medicaid and us in partnership with them is to have people be receiving preventative and care management in a primary care environment, so they don't need to have their health conditions degenerate or escalate so that they do need higher level care. So the goal is, together, if we can save the whole system money, we can all share within the gain on that. So we're incentivized to help promote and create and maintain health.
I mean, I think that's powerful to, I mean, that's why we all want value-based care, right? It is, let's, have the patient do the right thing. They receive the best care and we lower costs for everyone else. And what's been the structure, of how you're paying for this with Carecognitics?
There are basically two parts of it. One is a base platform fee, because there are expenses. I mean, they provide basically an entire enterprise data warehouse to us, and all of the messaging, the infrastructure, as well as their service, their thought partnership, their innovation. So we have a base platform fee, and then through that, we're also establishing what is our baseline previous costs, and then we share any of the upside on that. So thus far, we also fortunately received some grant funding to help with our first phases of this innovation and piloting. So that's helping to pay for the base fee. As well, on the COVID side, we are supported to help provide COVID safety and ideally vaccination to the community. So that's also helped with covering some of the costs on the platform with that as well. So we're excited to be on the path to have it be sustainable.
Awesome. So, where else would you like to apply the platform? Is there any next problems that you're like, yeah, okay, well, we've been dealing with COVID, but, now you're working on this, kind of value-based pilot. What else is on the horizon?
I would say what the value-based pilot did, it really did. It's like, okay, it's March. Let's talk about what we were talking to,
it's been
like,
a year, so let's do it. Awesome.
So it really is, we have a lot of areas where we have the quality outcomes that are really important to us and to our patients and to the healthcare financing system. In general, we have conversations around how we're going to expand into chronic care management relationships. So a pretty specific payment metric through Medicare itself. And then the bigger part that we have in our mind is really what the platform is designed to do, which is to help build relationship and build ease. So we see this as being, how can we use this to maintain that relationship with a patient over time, where they may, if we think about from the patient perspective, they may be somebody, I had never heard the word invisible. I think that's a really appropriate word. So they're invisible to us. We're pretty invisible to them. They get a weird government bureaucracy letter sent to them being like, oh, this is now happening to you. And that maybe they get introduced to us through this pilot, and then it comes in and they actually are managing a couple chronic conditions, that then they can start to have a way to check in and monitor, how is your blood pressure today, and be doing that over time. And they can maintain that relationship and be connected to real humans on our side who can, help say, no, you really need to come in based on what your blood pressure has been doing this week, or you're great, just keep living your life doing what you're doing. So that's the direction that we're going with this. And we think that's our near direction, and we're confident there's a lot more opportunity to continue using this as a bridge for connection with our patients and communities.
Excellent. Any other thoughts, Jennifer, on where you see this headed and how you can engage patients better?
I think Lisa covered it perfectly well. It's really the end goal is to get that relationship with the patient and to giving them the tools to be able to manage their health.
Awesome. Well, I want to thank you both so much for taking time to visit with me and share your insights and perspectives with the Healthcare IT Today audience. And thanks everyone for watching. If you want to find more great healthcare IT content like this, be sure to check us out at healthcareittoday.com. Thanks, Lisa. Thanks, Jennifer.
Thank you.